Hello and welcome to Tinnitus Matters, the podcast where we discuss all things to do with tinnitus. My name's Phil Holmes.
And I'm Christine Nixon. And today we have a very special guest, Chris Brockbank, who is the clinical scientist in audiology and service lead in audiology at Lancashire Teaching Hospitals. We welcome you, Chris, and thanks so much for coming on today to talk about tinnitus.
Yeah, thanks, Chris. We do appreciate how busy you guys are. Without further ado, we'll jump straight in. So how common is it?
It's extremely common. I know I have tinnitus for one. I think you have tinnitus as well.
I do.
It's more common than I think the stats suggest it is. And if you look at some of the stats, they'll say, well, it's 7 to 10% of the population. I think 7% of the population have troublesome tinnitus. But to be honest with you, I think there's very few people that don't, from time to time, experience some degree of tinnitus.
And is it always a ringing? I mean, you mentioned it was...
Yeah, there's lots of different causes for tinnitus, but by far the most common cause is wear and tear inside the inner ear. And that wear and tear inside the inner ear is the seed from which that tinnitus can then originate in the brain. Because what we need to look at is how that pathway works. The vast majority of people have tinnitus because of wear and tear inside the inner ear. And that wear and tear means that the cells aren't working anymore, but the nerves are still connected. So, for example, the wear and tear inside the inner ear here in the cochlea is a seed. But in order for that seed to grow into something called tinnitus, where we're actually perceiving this noise, lots of other things need to be in play. So, for example, you may have wear and tear inside the inner ear. Most commonly that's due to age and noise. Yeah. And that wear and tear, obviously... hair cells are still there. They're still not doing this. Sorry, the hair cells are damaged, but the nerves are still there and they're still firing. So they're attached to the inner ear, and because they're then sending the signal up to the brain then says, "Where's that coming from?" "Oh, it's coming from the ear. Therefore, that signal must be a sound, and that is then turned into the perception of tinnitus." So that's how it works. So the seed is the damage to the inner ear, but for the tinnitus to actually manifest, it needs a number of other conditions. So, for example, with me, I've got tinnitus right now in my right ear, and the reason for that is because I'm in such a quiet environment.
Yes.
I can actually hear that. So, for example, if you have a blockage there in the external ear, so that's the ear canal there, then that might be wax, or it might be a middle ear condition or something like that. That stops the sound coming into the ear, but it dulls the input of sound.
Yeah.
So what happens then is you get an increase in the volume of the system to try and pick up sound. It's a little bit like if the out of tune radio and you can't quite hear it, so you're turning the volume up, and all you're getting the static. The static's like the tinnitus, isn't it? It's something that's random that shouldn't really be there. As soon as you turn it into a channel, boom, you suddenly get all the sound coming through and things, and then immediately you turn it down, and that's exactly what hearing aids would do. But also, of course, taking wax out of an ear would do that as well. So it's, again, blockages here are one of the conditions that can help the seed here, as in this inner ear that's already damaged, to manifest into tinnitus.
Can I just ask about noise and kind of people... Because, I mean, I'm a musician.
Yes.
And I'm a drummer, so I've sat behind drum kits, hitting cymbals and drums, and sat next to bass amps and things like that. But there's also professions where... they're in noisy environments. How much is that a factor?
Oh, yeah. Well, it's less of a factor now because in the 1970s there was the Noise at Law Act, which basically meant that people had to start, they had to start wearing ear protection.
Right.
So when I first started in audiology, though, and this is going back now, I've been working in audiology over 40 years now, but when I first started, there were a lot of pensioners from the war pensioners.
Yeah.
And they're all coming forward because they got noise-induced damage as a result of the weapons and things they were using. And of course, they all had tinnitus as well because of that. So they were coming forward as a result of that. There was also a lot of people who worked in noisy industry.
Yeah. Like the mills, I suppose. The cotton
mills
mills around here.
Yeah.
I mean, my gran, she's quite funny actually because she used to be able to, do all this business like...
lip reading.
Well, yeah, exactly. What was his...
Les Dawson.
Les Dawson, that's the word I'm looking for. He used to live round the corner from him. I used to do all that business. And my gran was into that. And there was a car park across the road from where she lived, and she could hear exactly what they were all saying, or should you say she could lip read exactly what they were all saying.
It was almost a use. They had to do that to survive socially, to make their working day better.
Exactly.
Than sat at a mill all day.
Yeah,
if you can't hear each other, it's so monotonous.
Yeah.
I imagine. So you'd learn to lip read.
Yeah.
So you didn't
So it was
go
very,
crazy.
very loud, or should we say very intense. But although, to be honest with me, my grand's hearing was remarkably good.
Considering.
I did test it a few times, yeah. But so back then you had noise-induced hearing loss as a result of working in industry and, your work background. But these days it's far less because of that. But I think social, maybe in your field it might be more likely. I mean, certainly musicians. I've not met a musician yet that's not got noise-induced hearing loss. But there's probably are some out there somewhere.
I believe dentists have got quite high on the
drill,
the tinnitus list because of the drill.
Exactly, that loud pitch, high pitch. Again, the high pitches again, they're the ones that get damaged first. So they say more recreational in these days, and people need to be watching that, and even that's starting to sort of become less of an issue now, I think, as time, because there's noise regulations within the recreational world.
And can I ask, sorry, so you would go back to occupation, you were talking about ear protection. And I imagine, yes, they brought the law out and, you must protect in certain occupational. But how good was the protection? And how good is it now?
It's not perfect. There's no way you can if you're in a very, very noisy environment, how you can filter out all of the noise and not have some impact,
And it's any impact that eventually can cause tinnitus.
Right, so with noise, there's two types of damage to the inner ear. There's sudden impact noise, like that. So that will be a gunshot, for example, next to you, or an explosion.
Yeah.
Now that will cause two types of damage. It will cause physical damage to the inner ear, these little hair cells again. It'll physically damage them, literally the sound coming in there, bang. And that physical damage will not repair. So that's instant, permanent damage.
Wow.
But the more common thing is this what we call temporary threshold shift to start with. That's where the hair cells are so overwhelmed with sound that they can't work anymore. They just go into stun mode. They can't recover. So they have to take time to recover. And that's where you get a sudden temporary hearing loss. But also you get that tinnitus as well. So if you come out of a nightclub at late at night, you hear that screeching tinnitus, your hearing's a bit dull. That's usually temporary threshold shift.
So, Chris, can you do anything about that? So, just for the listeners, if they feel, it's a temporary, can they encourage it to come back?
Well, first of all, you shouldn't be getting to that stage in the first place, because once you start doing that and start getting that, it will naturally become permanent. It will naturally become that.
So that goes back to the wearing ear protection at gigs and concerts.
Exactly. You can't repair the inner ear once it's damaged. I mean, we'll obviously talk about that probably a little bit later about treatments for tinnitus and things and repair of the inner ear. So the best thing you can do at the moment is to not damage it in the first place.
Yeah.
Prevention's always better than cure, isn't it?
Yeah, absolutely.
So just whilst we're on that, so we've talked about kind of high pressure level, sound pressure levels and volumes and things like that, but can any underlying conditions like stress, hypertension or infections or anything like that trigger tinnitus?
Yeah. So let's go back along this pathway. So first of all, infections. Now the most common, you might have an ear infection, I was going to say ear, in the ear canal here. That will be like the wax, so that blocks up.
Okay.
Yeah. Now that in its own right might allow stuff that's already damaged further along to be more audible and cause tinnitus like that. Then there might be a middle ear infection, which is, it's not very good, this showing the middle ear bit here, but in fact it's in the wrong place anyway there, like that. But the middle ear here is like a fluid-filled chamber, and this little bit at the back called the eustachian tube usually allows air to flow either side of the eardrum, because for the eardrum to go backwards and forwards it needs to be within air. If you've got fluid behind the back of the eardrum, it can't move backwards and forwards.
Right.
It's a little bit like they always say, if you go into water in a car, you can't just open the door, you've got to let the water in first. You've got to have the same medium on either side of the door or the eardrum for it to be able to move backwards and forwards. So if you've got a middle ear infection, or what's very common in children is otitis media, it's where you get this inflammation of fluid within the middle ear, And it usually originates because this tube here, the eustachian tube, has become blocked, because in kiddies it's very, very tiny, and that blockage can then lead to fluid build-up in the middle ear. It can happen with older people as well, though, especially where we live, where it's all damp and cold most of the time of the year. So that, again, not a cause of tinnitus, but it can allow stuff that's going on further along to become more audible.
Right.
So stress, that was a good question.
Yes. So, again, other seeds, so that's your seed. So other things that can allow that seed to grow, so soil, could say that was the soil potentially there. You also need sunlight and water. So stress could definitely be the sunlight that brings out tinnitus. And there's good reason for that. And that's going back to my quick analogy then of where I used to live. I used to live on the flight path into Manchester Airport. And we'd have all the sort of sounds of the planes going over all day. People would come round and go, how do you put up with all that noise? And they go, what noise? Because you filter it out, okay?
You'd learn to get used to it almost.
Correct. Your brain adapts out because it's not important, it filters it out. However, the neighbours are back again. I can hear them because they're having another row. I can hear them. Now, the sound level, the intensity of the neighbours is nothing compared to those planes. But because there's a stress factor involved there, then they become more intense. Going back millions of years ago, we'd be there traipsing, let's say, through the jungle or whatever, and there's all that noise all around us. Suddenly there's a twig snaps over there. Now, last time we heard that twig snap, my mate got eaten by a moth or something. So it's important to hear that sound in all that other noise. So stress, first of all, if you're walking through the jungle, you're in a stress situation. So immediately you're heightened.
Yes.
Everything's on a more heightened alert. But sounds that are threatening need to be heard over the sounds that are non-threatening. And that is very important when we start to look at how treatments can help with tinnitus in terms of the more psychological approaches and how the pathways work for tinnitus, which is probably what we'll talk about, I think.
Yeah. Okay.
Thank you.
So let's say somebody's experiencing that. How is it diagnosed from your side of things?
Okay, so as I said before, by far the most common type of tinnitus is wear and tear inside the inner ear, which could be due to age, most commonly due to age and noise exposure. There are rarer examples. Example of, for instance, antibiotics, gentamicin, could potentially cause damage to the inner ear.
Can you give us a brief overview of the current intervention?
Right, so the most current intervention, so as I said before, if it's wear and tear of the hair cells inside the ear, there's usually hearing loss. And that hearing loss means that the nerves are still firing, but they're not getting the signal that you'd like them to. So what we do is we give a hearing aid that amplifies the sound, which then overcomes the damage of the hair cells, so the nerves start getting stimulated again. And by being stimulated again, that means that the volume inside the head turns down. The tinnitus can therefore be not one of a mask, but it's basically suppressed. Treating someone's anxiety and depression can help patients with their tinnitus.
What steps do you think should be taken to educate people at what ages and things like that about prevention and treatment?
Yeah. So prevention, certainly young people, I mean, obviously when you're young, you don't think about the future, do you? And you
Nope.
don't, I mean, I'm the same. I used to go to heavy concerts and things when I was younger.
I know we always like to say in clinic, we can prevent, but we can't always cure.
Absolutely.
Yeah.
So it's so important that the earlier and the sooner we grasp prevention, the more chance we have.
The less chance of permanent damage, like we were talking about before, to the ear.
So in terms of kind of the future of tinnitus and the future of this kind of area, what research is there, or is there any kind of research that you're particularly excited about that you know is on the horizon, or who's doing it?
Yeah, okay, so the classic one is we think of the hair cells inside the inner ear. Could we not do something to let's say, regrow them? Regrow the hair cells.
Right.
Well, that has been fascinating.
Fascinating, Chris. Thank you very much
Thank you
indeed.
so much
No
for
problem.
talking today
Thank you for having me along
to
talk.
us and our listeners. And I
Yes.
think you couldn't deny you've learnt something.
I
from
I
that
thought I knew a
information.
lot about tinnitus before we started this episode, and can I just say I've just learned so much by listening to you. So thank you very
You're
much
welcome.
indeed.
You're welcome.